235 Aphorism Organon of Medicine. With regard to the intermittent fevers that prevail sporadically or epidemically, not those epidemically located in marshy districts, we often find every paroxysm likewise composed of two opposite alternating states: cold heat, heat cold, more frequently still of three: cold, heat, sweat. Therefore, the remedy selected for them from the general class of proved common, not antisoric medicines must either, and remedies of this sort are the surest, be able likewise to produce in the healthy body two or all three similar alternating states, or else must correspond by similarity of symptoms in the most homeopathic manner possibly to the strongest, best marked, and most peculiar alternating state, either to the cold stage, or to the hot stage, or to the sweating stage, each with its accessory symptoms, according as the one or other alternating state is the strongest and most peculiar, but the symptoms of the patient's health during the interval when he is free from fever must be the chief guide to the most appropriate homeopathic remedy. Footnote 1. The pathology until now in vogue, which is still in the stage of irrational infancy, recognizes but one single intermittent fever, which is likewise termed ague, and admits of no varieties but such as are constituted by the different intervals at which the paroxysms are recur, quotidian, tertian, quartan, but there are much more important differences among them than what are marked by the period of their recurrence. There are innumerable varieties of these fevers, some of which cannot even be denominated ague, as their fits consist only of heat. Others again are characterized by cold alone, with or without subsequent perspiration, yet others each exhibit general coolness of the surface with a sensation of heat on the patient's part, or while the body feels extremely hot, the patient feels cold. Others again in which one paroxysm consists entirely of rigor or simple chilliness, followed by an interval of health, while the next consists of heat alone, followed or not by perspiration. Others again in which the heat comes first and the cold stage not till that is gone. Others again wherein after a cold or hot stage apraxia ensues and then perspiration comes on like a second fit, often many hours subsequently. Others again in which no perspiration at all comes on, and yet others in which the whole attack consists of perspiration alone without any cold or hot stage, or in which the perspiration is only present during the heat, and there are innumerable other differences, especially in regard to the accessory symptoms such as headache of a peculiar kind, bad taste in the mouth, nausea, vomiting, diarrhea, want of or excessive thirst, peculiar pains in the body or limbs, disturbed sleep, delirium, alternations of temper, spasm, before, during, or after the cold stage, before, during, or after the hot stage, before, during, or after the sweating stage, and countless other varieties. All these are manifestly intermittent fevers of very different kinds, each of which, as might naturally be supposed, requires a special homeopathic treatment. It must be confessed that they can almost all be suppressed, as is often done, by enormous doses of bark and of its pharmaceutical preparation, the sulfate of quinine, that is to say, their periodical recurrence, the typhus, may be extinguished by it, although often only after increased and frequently repeated doses. But the patient who suffered from intermittent fevers for which cinchona bark is not suitable, as is the case with all those epidemic intermittent fevers that traverse whole countries and even mountains districts are not restored to health by the extinction of the typhus. On the contrary, they now remain ill in another manner, and worse, often much worse, than before. They are affected by peculiar chronic bad dyscrasias, can scarcely be restored to health even by a prolonged treatment by the true system of medicine. And yet that is what is called curing. Footnote 2. Dr. von Bonninghausen, who has rendered more services to our beneficent system of medicines than any other of my disciples, has best elucidated this subject, which demands so much care, and has facilitated the choice of the efficient remedy for the various epidemics of fever in his work